How the emergence of the white underclass could improve education for all. My proposition is that illegitimacy is the single most important social problem of our time, more important than crime, drugs, poverty, illiteracy, welfare, or homelessness, because it drives everything else. Doing something about it is not just one more item on the American policy agenda, but it should be at the top. In 1993, when the largely white and affluent readership of the Wall Street Journal read this editorial excerpt, the presumption was that the author must be referring to the unfortunate denizens of the urban ghetto. The face of illegitimacy then and now were low-income black and brown people incapable of delaying gratification. Without urgent action, these impoverished people would continue to raise staggering numbers of children in single-parent households. These poor souls would then perpetuate the pathologies that were figuratively and literally burning down their neighborhoods. But the title of the essay was The Coming White Underclass, and the author was Charles Murray. Yes, this is the same Charles Murray who today is being apoplectically protested by college faculty and students who likely have never read his 1993 essay, nor Coming Apart, the State of White America, which in 2012 foreshadowed the conditions that would later drive the Trump presidency. Nearly 25 years ago, Murray sounded the alarm at what would happen if the long, steep climb in white out-of-wedlock births was not arrested. The white underclass will begin to show its face in isolated ways. Look for certain schools in the white neighborhoods to get a reputation as being unteachable, with large numbers of disruptive students and indifferent parents. Talk to the police. Listen for the stories about white neighborhoods where the incidence of domestic disputes and casual violence has been shooting up. Look for white neighborhoods with high concentrations of drug activity and large numbers of men who have dropped out of the labor force. 24 years later, Nobel Prize winner Angus Deaton and his wife Ann Case have answered how well the white community heeded Murray's ominous predictions. In a groundbreaking study, the two Princeton economists document a startling rise in the number of deaths of despair, deaths by drugs, alcohol, and suicide, of middle-aged and non-Hispanic whites in the U.S. with a high school diploma or less. Since 1998, white morbidity, the rate of disease in population, and mortality, the rate of death, became markedly worse and geographically scattered. According to the Brookings Institution, the increase in white morbidity began in the Southwest in 2000. By the mid-2000s, it had spread to Appalachia, Florida, and the West Coast. Today it's countrywide, from deep rural areas to large central cities. Stunningly, this increase in the white mortality rate has become amid the context of gradually improving outcomes among blacks and Hispanics. In 1999, the mortality rate of non-Hispanic whites aged 50 to 54 with only a high school degree was 30% lower than the mortality rate of blacks in the same age group. By 2015, it was 30% higher. There are similar crossovers between white and black mortality in all age groups from 20 to 25 to 60 through 64. Not surprisingly, the suffering of this older generation of whites has been passed down to the next, most visibly through drug abuse and addiction. A recent New York Times feature, Inside a Killer Drug Epidemic, details how America's opioid crisis has claimed more than 300,000 mostly white lives in the last 15 years, including some 33,000 in 2015 alone. Enough opioids are now prescribed in the United States each year to medicate every man, woman, and child around the clock for 1 month. Some public health officials consider it the worst drug crisis in America, even more crippling than the crack cocaine scourge that devastated minority communities in the 90s. In education, the opioid epidemic has forced school nurses in states as varied as New York, Kentucky, Connecticut, New Mexico, Massachusetts, and Pennsylvania to stock naloxone, an antidote for people who are overdosing on prescription painkillers and opioids like heroin. Like other states considering similar legislation, Rhode Island now requires every middle school, junior high, and high school to have naloxone on hand and ready for immediate distribution. This rise in deaths of despair among middle-aged white Americans, the lethal and accelerating opioid epidemic being experienced by the subsequent generation, and the telltale signs that the youngest generations of whites will face its own struggles, as exemplified by poor literacy outcomes of white fourth graders, are all symptoms of a deeper dysfunction. Why is this happening? In 2015, Closing the Opportunity Gap Initiative, organized by the Seguro Seminar, attempted to answer this question. A dozen of the country's leading experts in education, family, and parenting drew upon the findings of Harvard professor Robert Putnam's 5-year effort to research the growing inequality gaps in America and why fewer Americans of all races were upwardly mobile. The group identified a tangle of causal factors, including an unraveling of the social fabric and safety nets in working class communities, segregation along class lines, and economic insecurity. But a key takeaway was growing up with two parents is now unusual in the white as well as non-white working class, while two-parent families are normal, becoming more common among the upper class, both white and non-white. Most Americans are unaware that the white working class family is today more fragile than the black family was at the time of the famous alarm sound in 1965, The Negro Family, The Case for National Action by Daniel Patrick Moynihan. Despite Murray's warning in 1993, the white underclass has arrived, spurred by a wave of his forewarned rise in illegitimacy. As Figure 1 shows, for 5 decades, an explosion in unplanned out-of-wedlock pregnancies and births has been at the heart of the slow, steady collapse of the low-income American family, white, black, and brown, further entrenching an already vulnerable populations in multi-generational poverty. The resulting family instability, the reduced stigma around absent fathers, and the normalization of single parenthood, especially to women aged 24 and under, must now be recognized as a key causal factor for why so many poor and working class Americans across races are struggling to succeed in school and life. Noted Johns Hopkins University sociologist Kathy Eaton has extensively studied poverty through ethnographic observations and in-depth interviews with hundreds of unmarried low-income mothers and fathers. Her eyewitness research helps explain why so many poor women have a baby first without marrying, and why men continue to father children before they can afford to take care of them. Eaton's must-read books, Promises I Can Keep, Why Poor Women Put Motherhood Before Marriage, and Doing the Best I Can, Fathering in the Inner City, reveal that poor young women and men of all races share a common set of human desires to get a good education, secure a decent job, fall in love, marry, raise children in a stable home, and earn a salary that can provide dignity and is sufficient to support their family. But an array of structural barriers, neighborhood effects, and family precedent and dysfunctional norms derail them, leading to choices that unwittingly perpetuate their poverty and virtually guarantee the same outcomes for their children. But whatever regretful choices these parents may have made, Eaton's work also reveals parents' deep commitment to helping their children build lives that are different and better than their own. It is why many poor parents enter lotteries for public charter schools on the slim chance that their child wins a golden ticket. They fight for seats in excellent schools, not only so that their children can learn math, science, and the arts, but also because they want us to teach their children the most reliable path to life success that will allow them to overcome the obstacles they faced as parents. If we want to break the multi-generational cycle of entrenched poverty and income inequality, we must ensure the next 2 generations, the children in K-12 schools today and their children understand the mechanisms that will lead to upward mobility. There is a sequence: education, work, marriage, children, after the age of 21, in that order, that many of us in our personal lives have chosen to follow because we know it gives us and our children the greatest likelihood to lead lives of our choosing. We cannot deprive our students of the very knowledge that if they followed the same series of life choices, they would have a 98% probability to advance out of poverty and a real shot towards middle class success and beyond. In his 1993 essay about stemming the tide out of wedlock births, Murray opined, matters have not yet quite gotten out of hand, but they are on the brink. If we want to act, now is the time. Since 1993, the national out of wedlock rate rose from the already catastrophic rate of below 30% to more than 40% today. During that time, more than 20 million babies of all races were born to unmarried women aged 24 and under. While there are always exceptions of children and single parents who succeed despite the odds, the vast majority of affected children are suffering the dire consequences of premature family formation. But it's never too late to make things better. The education reform community has a unique role to play because children of the next generation are in our schools today. Perhaps the only silver lining in the emergence of the white underclass is that it could empower all of us to recognize that racial bias alone cannot explain conditions many of us have committed our lives to reversing. Perhaps the only silver lining in the emergence of the white underclass is that it could empower all of us to recognize that the racial bias alone cannot explain the conditions that many of us committed our lives to reversing, that the white community is being devastated by drug abuse and deaths of despair, creates an opportunity for a unified effort to address the family fragmentation that threatens our common humanity. Racism and poverty still matter and must be addressed, but family structure matters monumentally to the ultimate success of our children, and ironically may be the best support to empower young people to have the personal agency to overcome racism, poverty, or adversity of any type. Our parents want and need us as education leaders to be the adults in the room, not silenced by political correctness or fear of accusation or moralizing. They want us to talk openly to our students about the best path to achieve dreams they have for their children. By having the courage to do so, we would be fulfilling the hopes and desires of the parents who have entrusted us with the most cherished responsibility of educating their children. Let us live up to the highest of their expectations. And this is from the Thomas B. Fordham Institute, and is written by Ian Rowe. Very, very long piece, very, very long essay. He's saying the same thing that I've been saying for a while. This is structural. This is structural. They know it's structural. There's a book that I have yet to read. I'm actually going to read the damn thing. I might read it this week. The Decline of Marriage, where they had back in 1989 a whole conference on the decline of marriage and what they could do about it. Now, the essay that Charles Murray wrote was in 1993. 1993. The black birth rate was already out of hand. It was already gone. It was already about 70%. The white birth rate hadn't reached that yet. I think the white birth rate was maybe 1993. I think the white birth rate was maybe out of wedlock birth rate was below 20%. It is now 30 and rising. And the national birth out of wedlock birth rate is 40% and still rising, even though the black out of wedlock birth rate has plateaued. The same effects that we felt back in the 70s and 80s, they are being felt by white folks because they didn't realize that this is structural, because it looked like a black problem. It looked like a black problem that could be corrected. They didn't know that this was so structural that there's very little that they can do about it. And all they did with the policies that they put in by freeing the women has exacerbated this problem. Can it be fixed? Personally, I doubt it. I don't think people have the will or the want to actually change things. I made 3 observations and solutions to fix things. All 3, I have no doubt that there's very little chance of it ever happening. But without those 3 things being implemented, as far as the family structure and the society that we know and we have grown to love over the past 100,000 years is probably gone. They're going to have to figure out something else. They're going to have to figure out something that fits this cultural and physical environment. And so far, I think they're bewildered. I don't think they have a clue about what they need to do because the problem's too big, it's too widespread. And the thing is, it's structural. Why do I know it's fucking structural? Because it's not just happening here. If it was in the United States or even Canada, you could say, okay, it's societal because Canada and the United States are very similar. Mexico is not. Chile is not. Colombia is not. Panama is not. And there's other places that are in Asia that are on their way. This is structural. And the reason it's structural is because you do not need to have children. The state needs your children far more than you do. That's how come they're willing to subsidize it. But because of the Industrial Revolution and the lack of need for children as a labor force, it has slowly but surely not only eroded the fertility rate, but also the marriage rate. Why is that so? Marriage is not for the 2 people getting together. Marriage is for the children and the raising of families. What happens if you don't have families? What do you think is going to happen to marriage? And once the institution of marriage, the instrument of marriage gets damaged, then it means it's damaged and most people will not like to do it. Even though biologically women still want to have children. In this article and the one I just read yesterday and the one I'm going to probably do tomorrow will all point to the same thing. You can make excuses for why it happens in the United States, but you can't make excuses for why it's happening in China or Korea or Japan or Sweden or Norway or Chile. Different societies. We don't all think the same, but we do have the same biological urges. But anyway, that's all I got for this one. This is BGS out, and I will see you guys on the next one.